as a mental health specialist, we in the ministry presently, um, what's in now your assessment of we mental health situation now this country presently, with the drug abuse or get substance abuse, whether not drugs or alcohol, as you say.
Yeah, Sierra Leone is like any other nation now in the world. Mental health issues not only peculiar to we, it's a global thing. And it's just that we lack the resources, the infrastructure, the manpower, and the rest. But mental health, it's all over. It's a serious thing currently, globally. In fact, some countries that you can't talk about your manifesto without mentioning mental health, are you able address mental health challenges. So it's a global thing. For Sierra Leone, if you consider waiting we don't undergo for the past years, the civil war, the Ebola, the mudslide, now the COVID we just passed, and now this substance abuse, Kush, and the Mpox. So all those things, if they combine together, now a potential risk for anybody for develop a mental health condition. And they don't do studies which show say in post-conflict nations, there is 1 in every 5% prone to a mental health condition. So the mental health situation for Sierra Leone, it need investment for make we be able to address the issues there. We get so many undiagnosed people. The unfortunate thing is we don't ever do a national mental health survey for know exactly what are the prevalence of their mental health conditions there. For example, depression, what are the percentage of people there where we get depression or anxiety, we're very common. We not do that national survey yet. But that all now the plan we'll get for make we do a national survey, for make we able to determine what are the prevalence of their mental health conditions.
With the cases and presently, what's in now the reason we perhaps with the cases where they can through the existing structure, say the psychiatric home, say within at the age brackets of people and within can lead them to mental health situation.
Yeah, we do a study, a national study for look at the prevalence, risk factors, and the mental health conditions we associated with substance abuse last year. And we see, say, the prevalence is high, about 62% of the people away we interview, about 16,000 people in the community nationwide, with about 62% they abuse psychoactive substance, including alcohol. Then again, we see say majority of them are the youth between the ages of 18 to 35 years, where a very productive age. So if a nation don't get that kind of population, they abuse substance, it means it's serious, and we need to come up with interventions there for make we able to address that one day. So between the ages of 18 to 35 years, mostly male, and from Western area and Kush, now the most prevalent, second to Tramadol. Yeah.
So you don't there na the sector. You talk about the need for resources. Is it about the infrastructure or the human resource, the capacity of people where they provide psychosocial services na the health infrastructure?
It includes everything. It includes everything. Both human resource. For example, for psychiatrists currently, now we 3, then we get 2 Nigerians there, where government came a contract. So basically, nationwide, I would say now we 5 currently. 3 Sierra Leoneans, 2 Nigerians. If you look at addiction professionals there, thank God the government they actively collaborate with ECOWAS. Where ECOWAS they train addiction professionals there. Currently, we get like 27 addiction professional in terms of treatment. They will get like 25 for prevention. So get like two type of for how for manage people with substance abuse. We get the treatment pathway, then we get the prevention pathway. So in total, it's like 52 addiction professionals nationwide. And even the addiction one day where they don't treat it, where they don't train in terms of treatment, they now get the certificate because they need for sit an exam, an international professional exam for certify them as addiction professionals. So we get that issues there. They also get a challenge, for example, for clinical psychologists. We don't get none, not the public sector, nobody. We only get one, we also on a contract, where they work at the hospital. Occupational therapist, the one who we get, in back, will not get any in the public sector. In passed on, I think, early this year. So it means there is a huge gap in terms of the manpower. In terms of infrastructure, although currently we try to move away from hospital-based to community-based, however, we need to create a mental health unit now each of the district and regional hospitals, at least from 5 beds, make we get means for admits the people where they get mental health issues for make we able for stabilize them. There are so many issues, even in terms of funding. Currently, the budgets for mental health is less than even 0.1% is less than. Very, very small. Not only in Sierra Leone, but global. The investment is very, very poor. And then also, if you look at even the digital innovation, for example, for make you there, you're able to talk to a psychiatrist within McKinney or Bo. Also, there's a challenge. But with the new mental health strategic plan, we will incorporate all those things in them for make we able to address mental health in a holistic
you know, the
way.
first person they appoint at this position, how you they deal with all the challenges there are and for address them, for ensure say mental health is streamlined in we funding, even with government, and also na the health sector, people they understand say this should be part of. If somebody they can complain for malaria, una go pay them attention. If somebody come and they show signs of mental health, una go give the same attention.
Yeah, not to be the first way that I appoint now that
Okay.
position. I like get like 2 predecessors there. So I'm not the third. The only difference is now I'm not the first mental health professional.
Way they serve there.
We they don't appoint
Point for
serve-
serving at that
no,
position.
yes.
Yeah. Somebody will get the mental health background.
Yes. So, and yes, waiting we dey try for do basically we dey try for approach mental health in a holistic way. Them using the life stage approach from pregnancy up to senior citizen, wherein we dey try for integrate mental health into disease-specific programs, just like how you mentioned, malaria, TB, HIV, so that we're able to treat these individuals holistically, because there is no health without mental health. And then also, we see say if we're able to integrate mental health into the programs that mental health go able to get the visibility or the care we in need. Because somebody go get malaria, we get what we call cerebral malaria, we can make person behave abnormally. Somebody go get HIV, where that person go get what we call adjustment disorder, depression, anxiety, and even in the worst case, you get what we call psychotic disorders there. TB, it's the same thing. So now we dey try for integrate mental health into all the programs that they, and also we dey try also for for what we call multi-sectoral approach, wherein we dey involve other ministries, departments, and agencies. So the plan is this: we dey try for establish a mental health desk in, in each of the MDAs, and also for look at the workplaces, the private sector, also get for coming. So for the funding, another approach we dey use as a ministry, and also currently we dey try for develop an investment case where we go able for pitch to donor partners there for support mental health.
Yeah.
Yeah, but we for not say mental health or health in general, not to just the Ministry of Health. Although the Ministry of Health now the custodian of we health status in the country, but we need other people for come on board for support.